Morena, everyone. Tēnā koutou katoa. Welcome on behalf of Auckland City Mission Te Tāpui Atawhai to Home Ground, our Integrated Health and Social Services Centre. It is my great privilege to have you here today and to see so many familiar faces in support of the kōrero around innovation in this space. From our perspective, as an organisation, we have and will always support innovative initiatives that enable equitable access to services and opportunities to reduce the harm that alcohol, drugs and other substance abuse causes throughout our community. So we look forward to some exciting and innovative solutions. And now I have a couple of really boring announcements, but quite important. The first is that the bathrooms are out and to your right. The second is if there should be a fire alarm, and those of you who have opened new buildings will know that it's not unusual that fire alarms do occur. Please take direction from a warden who will arrive, and we'll make our way to the stairwell, which is just past the bathrooms. So that's enough from me, and now I believe I will hand over to Sarah. Kia ora.
Kia ora tātou katoa. Thank you, Jackie, and thank you so much for hosting us today and for all of the work that you do in this amazing facility here. And thank you all today for coming along, for your presence, for your support, and for indeed the work you do every day. And thank you to the Facebook audience as well for coming along. Today marks Overdose Awareness Day, and we are joined today by many people around the world calling for overdose interventions. Today I'm going to touch on a couple of interventions we would like to see. As you know, the Drug Foundation has been pushing for overdose and drug harm reduction measures for many years. We were at the front of calls back in 2016 and 17 when we started to see synthetic cannabinoid issues emerge. And we have continued to work alongside many of you here today and other frontline organisations to address and try and get ahead of synthetic cannabinoid harm and overdoses and other drug harm and overdoses. We have lost at least 51 New Zealanders to synthetic cannabinoids since then. And while there's been a really recent slight decline in synthetic cannabinoid harm, it continues to be a drug that is favoured by people who've experienced a great deal of trauma and or homelessness. And that's because it's cheap, powerful, effective, and is very likely to make you pass out. We lose about another 50 New Zealanders every year to opioid overdose. Māori are disproportionately represented in those figures. We are 3 times more likely to die of overdose. We don't have to think too hard, therefore, about who would be most hit if New Zealand, Aotearoa, was to experience an opioid crisis in Aotearoa. However, it could indeed hit any part of our drug supply, and that is exactly what happened several weeks ago in the Wairarapa when, fortunately, it hit a relatively small batch of what was thought to be cocaine by the purchasers. This is the most dangerous situation with fentanyl, where somebody is taking it and doesn't realise that they're taking it. Because it's so powerful, a small amount can be the difference between overdose and fatality. And so we were so incredibly lucky to not have any fatalities among those 13 people hospitalised. But a fentanyl adulteration could in fact occur in any part of our drug supply. And so to give an indication of just how rapid that change could occur, within a space of a couple of months, half of our MDMA supply ended up being eutalone or synthetic cathinone. So these sorts of changes in our drug supply can happen incredibly quickly. And in this situation, should it be fentanyl, we would actually be quite stuck. while we can detect fentanyl in the drug supply now, thanks to drug checking and our early warning system, we would most likely see hospitalisations or fatalities first. And indeed, it was hospitalisations that we saw first in the Wairarapa incident. And the problem is we still don't have the regulatory or funding settings to be able to give out naloxone, the opioid overdose reversal medicine that we need to in order to prevent fatalities. And so therefore, my team and our partners, many of you here today, would be stuck. We would not be allowed or able to distribute naloxone. So to be clear, what we need in terms of naloxone access, we need it to be in the hands of people who use drugs. We need it to be in the hands of their friends and whānau. We need it to be in the hands of every first responder. For example, in Paikakariki, where I live, a small town, it is the local fire brigade, community volunteers that are there first on scene. They need naloxone, easy to administer naloxone. If somebody overdoses from fentanyl in the community, it can progress incredibly rapidly. So they're unlikely to make it to hospital in time and survive until an equipped ambulance or indeed they make it to hospital. So we need it to both prevent those 50 overdose fatalities that we're already experiencing, but also to prepare us for an opioid crisis or fentanyl outbreak here. It will be too late to wait till it's happened. As I say, our hands will be tied. We have two types. One is only available on prescription. It's funded, but I can't give it out as a layperson. You can't get it over the counter. The other type, I'm allowed to give out as a layperson over the counter, but it costs $90 a pop. The international evidence points to people who experience homelessness as being likely to bear the brunt of any opioid crisis, as they are currently with the synthetic cannabinoids and other drugs, which leads me into the main announcement today. And before I get into it, I do want to clarify that not all people who experience homelessness use drugs. With something like 1 in 6 New Zealanders having experienced homelessness now, we know that that is not the case. We also know that not all people who use drugs experience homelessness. And in fact, drug use spans every part of society, all social groups. Yeah. However, some of the acute harm and overdoses are concentrated among the group who experience both homelessness and are using drugs, and some other groups that I don't want to ignore today either. So we have been working to react to incidents of synthetic cannabinoid harm and overdose when they occur, alongside many of you here today in the frontline organisations I was referring to earlier. But to forgive a bad metaphor here, this is ambulance at the bottom of the cliff stuff. So we are reacting after harm has occurred, and we are essentially, not by our own choice, maintaining a baseline level of overdoses. My team and I have been scratching our heads. We are not prepared to accept that baseline level of overdoses. We want to break that down and get rid of them. As a society, we are effectively turning a blind eye to this harm, knowing it's occurring, but doing nothing much about it, because actually the law prevents us from doing the things we know that need to be done. Actually, law and stigma, I'll say. We know, and the police will know as well, that arresting these people is really not helpful. And that is about the only tool we have in the outdated 1975, slightly ancient, as old as me, Misuse of Drugs Act. So, meanwhile, police and ambulances are called out with painful frequency. I am told attending the same person as many as 3 times a day. We have seen play out in the media stress, concern, fear and frustration from local residents and businesses. And this is actually understandable. It is distressing to see somebody heavily intoxicated, passed out, or in fact overdosed. Synthetic cannabinoids in particular can even make you quite aggressive when you come to. So of course it is stressful, and that is something we do want to address as part of this proposal today. We need out-of-the-box solutions. We have already banned synthetic synthetic cannabinoids. It's been a long year preparing this proposal. And that's the only tool, aside from, banning it and arresting people, that the current law provides for us. We cannot magic away the underlying issues that are causing the situation. Homelessness, severe mental distress, colonisation, child abuse, etc. These are issues that need to be worked on, but they are long-term and difficult to resolve. And in the meantime, people are facing overdose and loss of life. The Drug Foundation and our friends and partners and stakeholders think we can do better. We can do better. We must do better. The Drug Foundation is not afraid to put forward the solutions because we must. New Zealand is so behind on overdose measures. We will hear about some of the innovation that's happening around the world from our other guest speakers this morning. But today we want to propose a very specific solution to the problem that we're outlining, one that is both more compassionate, health-based, and better for the wider community. It is not a new idea, it's just new to Aotearoa. We have consulted with a range of stakeholders and have the full endorsement and support of many today. Our proposal has been co-authored by ourselves, by Ngāti Whātua o Ōrākei, the Needle Exchange Services Trust. We've had support from as far-ranging friends such as Heart of the City, Community Housing Aotearoa, Odyssey, the Centre for Addiction Research, New Zealand Prostitutes Collective, Hapaete Hauora, Nurses Society of New Zealand, and ADO Trust, and I probably forgot a number. We have consulted a range of stakeholders today, including the City Mission, police, health, housing, and other NGOs. Many of you in the room today. Our specific request is for a 3-year evaluated trial of an overdose prevention centre in inner city Auckland, like many countries and states have had for many years around the world, including Australia's famed Uniting Church in Sydney. At such a space, the community of people most at risk from overdose, and I've referred a lot to the community experiencing homelessness, but there are other groups and other drugs that I haven't referred to as much today that may need this service as well. To be able to come in, get their drugs checked is sporadically available at the moment. And there would be a drug consumption space with qualified nurses and other medical and peer support workers supervising them to prevent overdose and put in place resuscitation measures if needed. It would involve tending to any other health or social needs that the clients indicate that they want to have addressed. I can feel myself flushing up with nerves. So, kia ora, thank you for your support today. The evidence is clear. These spaces are incredibly effective at preventing death and overdose. Other speakers today will tell you that the evidence is also clear that they do not encourage more drug use. Rather, people who use them tend to be more likely to seek treatment or other social or health interventions. We need one now. We need one in inner city Auckland specifically. We need one for the community of people that are already at risk of overdose every day. We need one to alleviate the pressure for local businesses and residents. We're asking for a 3-year trial. We would wrap research and evaluation to approve its efficacy and make sure we've done it right for an Auckland Aotearoa setting. The Centre for Addiction Research are represented here today and would love to be able to undertake that research. We sought legal advice. You will be aware the Misuse of Drugs Act 1975 is a right royal pain. We would love to see full legislative change that would mean that we would have a drug law that supports rather than hinders people's health and prevents death. However, we have located a section in the Misuse of Drugs Act that contains provisions that allow the Governor-General via Order in Council, which is a measure that Cabinet can take, to grant licences to allow some things that are normally banned under the Misuse of Drugs Act to occur. So in fact, we could be granted a licence, and that's what we're asking for today. This option is similar, I believe, to an approach taken in Vancouver in the early 2000s. Originally, they were essentially operating under a federal government exemption, and years later, the law was amended to legalise supervised drug spaces. On Monday night, on behalf of the Drug Foundation, Ngāti Whātua o Ōrākei, New Zealand Needle Exchanges, and the large group of stakeholders we have in support, I emailed a group of ministers and asked them for their help to this end. My email contained an outline of our proposal and a specific request to pass an order in council to permit a licence to be granted for a group of frontline organisations collaboratively to work together with Ngāti Whātua and ourselves, needle exchanges, to oversee such a trial and jointly operate the licence. I look forward to their response. Lastly today, I want to send love to the many New Zealanders who have experienced and or lost friends or family to overdose. Often their pain and suffering has been made invisible and silenced by stigma and shame. And I call for us to put aside that stigma and replace it with the compassion and understanding that we pride ourselves on in Aotearoa. Moi mai rā to those we have lost. May your lives not be lost in vain. Kia ora. Now we're about to be joined by the Right Honourable Helen Clark, who you will know as our former Prime Minister and as the Chair of the Global Commission on Drug Policy, who's going to share a few thoughts virtually. Obviously, she's not actually here.
Kia ora, Sarah. Kia ora, Jackie. Kia ora, everyone who's gathered for this really exciting announcement. And it is exciting to see the Drug Foundation consult so widely and get so much buy-in from key stakeholders on launching a safe consumption space pilot in Auckland. As Sarah just said, often these kinds of facilities don't begin because Parliament's been through a huge process to pass a new law. That takes time, as we know, and the Misuse of Drugs Act has been crying out for reform for decades now. But there is a mechanism, as Sarah explained, through an order in council, which is something that the Governor-General signs on the advice of ministers, which could get a safe consumption space up and running in Auckland quite quickly with the political will. Now, as Sarah said, there's nothing new about this concept. What is new is it's new to Aotearoa, New Zealand. In Europe, there are dozens and dozens and dozens of these facilities across the cities, large towns of the continent. It's been a struggle in the United Kingdom, which has had a very strong prohibitionist bent, which has impacted on the availability of harm reduction. And in the last couple of years, I've been giving support to a community-based initiative in Glasgow where, out of sheer frustration, an individual who had himself been a user of drugs, injecting drugs on the streets, set up a mobile van to confront the issue. And people came off the mean streets of Glasgow into his van to consume safely. But continental Europe, we've seen lives saved for some 35 years since the first of these kinds of facilities was set up in Switzerland, and actually able to be set up in Switzerland by my predecessor as the chair of the Global Commission on Drug Policy, Ruth Dreyfus, who was the health minister at the time and later went on to be the president of the Confederation of Swiss states. So the idea has always been to provide a place for the most marginalized, but anyone really who feels that it would be better for them to come into a safe space, can test their drug, can consume under supervision of a professional, and ensure that in so doing, they come out alive. You know, what really drives us here? We don't want to see our whānau dying on our streets. We don't want to see them dying alone in their homes because they bought something unsafe and or they consumed it in an unsafe way. This is about saving lives, preserving health, preserving abilities. And I always have in the back of my mind as I say this, a younger friend who many years ago suffered from a major overdose, and he lived to tell the tale, but with an amputated limb and another one severely impacted. So these are the consequences which many whānau across New Zealand are aware of, with the cumulative toll over the years of people not being able to consume safely. So the concept in Europe has always been provide the space for people to come in, non-judgmental, be able to consume safely. The naloxone is on hand should there be any issues. These spaces are often also the first entry point for people to access services, people who would not go to a traditional service. It can be the space where they begin to get a primary health care referral to a doctor. So, I'm all for it. This is long overdue in our country. We need it. We need it not only in Auckland, we need it in other spaces as well. And I would hope that instead of there, being the, what shall I say, shock jock, talk back radio sort of reaction of, what on earth are these people proposing, that people will say, hang on a minute, this is a good idea. People can come in, they can be safe, they can, walk out with their heads high. People aren't going to die if we provide these kinds of spaces. So we've seen in the past bipartisan support for important harm reduction initiatives. The New Zealand Needle Exchange is not a politically controversial initiative, but it's one of the last big harm reduction initiatives we had, and it goes back to the late 80s. It's good to see that Te Aotearoa, which was aimed at addressing the health and social needs and well-being of people who use methamphetamine, has had bipartisan support in Northland and now being rolled out in the Eastern Bay of Plenty. We need that nationwide as well. So let us hope that this sort of space could also get that kind of support. That would be my wish. Now, my bigger wish, as Sarah says, will be to see the Misuse of Drugs Act actually amended to reflect modern day realities. I'm also aware that Ireland 5 years ago actually passed specific legislation for facilities like this in the country. It's the Misuse of Drugs Act, Supervised Injection Facilities Act of 2017. That could be something that we could aim for even prior to a major overhaul of the Misuse of Drugs Act. Who knows? But this can be done. And believe me, it will save lives. One more word on naloxone being available, the antidote for a drug overdose. The World Health Organization recommends that naloxone be available to be administered wherever there is a risk of drug overdose. It needs to be much more widely available in New Zealand, again, as a life-saving measure. So lots to think about here on this day of Overdose Awareness Day, and full marks to everyone who's come on board with the Drug Foundation to put up this exciting context. And Sarah, I hope you get a reply to those emails, and I hope it's positive. Kia ora, everyone, and best wishes.
Kia ora, Helen, and thank you for your support. I'm going to introduce an amazing speaker now who has joined us from Canada. We've been billing him as the Canadian Michael Baker. He's an epidemiologist, and that's the only epidemiologist that we all know, I think. He also has expertise in COVID, HIV, and drugs, which is also similar to our well-known epidemiologist here. Dan has, or Associate Professor Dr Dan Werb, is a musician as well, but he has some other things. He is the a research scientist at MAP Centre for Urban Health Solutions. He's an assistant professor at the University of Toronto, and he's also the executive director of Centre on Drug Policy Evaluation at MAP, and in fact is going to speak to us a bit today about some evaluation he's recently conducted on overdose prevention centres like we've been calling for today. Kia ora and welcome.
Thank you so much for having me today and giving me the opportunity to speak, and congratulations on the release of this really important proposal. So I have spent the last 15 years or so working to understand and respond to substance use and drug policy issues in Canada and internationally. And in Canada during that time, I've witnessed two major epidemics. So the first was an HIV epidemic among people who use drugs that occurred beginning in the 1990s in Vancouver. And then the second, which is my home city, and then the second is a national and in fact North America-wide epidemic of overdose driven by not only the emergence of synthetic opioids like fentanyl, but also co-adulteration and just with a range of other drugs, including benzodiazepines, synthetic cannabinoids, and nitazene class opioids that has just brought chaos to our drug market. So the main message that I would like to communicate to you is really simple. It is, please learn from our experiences, but also learn from our mistakes. New Zealand can avoid the devastating loss of life that Canada has experienced and the deep generational trauma that the overdose crisis in particular has enacted. So just to give you some perspective, in Canada, we have had more people die of an overdose in the past 5 years since the emergence of sort of the fentanyl era than have died of COVID. And while our COVID numbers have kind of peaked at around 30,000 and are declining, the numbers of people who are dying of overdose is actually increasing year over year. And it is a very dire situation. And I'm hoping that I can share some of the scientific evidence and experience from Canada to inform some decision making here in New Zealand. So I just want to note that New Zealand is in an exceptionally lucky position to be able to put overdose prevention measures in place in a proactive and not a reactive way. The proposal that was announced today for an overdose prevention site, I think, is an exceptionally forward-thinking move that should be taken really seriously. So overdose prevention sites, at their most basic, pose a simple question. Would you rather people who use drugs do so outdoors or in semi-public spaces, or would you rather, when people use drugs, they do so in private spaces supervised by medical staff? Public drug use, as Sarah mentioned, can raise neighborhood tensions and place people who use drugs at a risk of a range of harms, including unmanaged overdoses, overdose fatality, but also infectious disease and violence. And OPS, overdose prevention sites, can mitigate all of those problems. So Canada introduced its first overdose prevention site, which was called Insight and remains in place today, as a medically supervised injection facility in 2003 in Vancouver, amidst an almost decade-long HIV epidemic that was focused around among the city's population of people who inject drugs. At the height of that epidemic in 1996, almost 30% of people who inject drugs in Vancouver were estimated to be HIV seropositive. So things had gotten dramatically out of control. The origins of the HIV epidemic are interesting, but much like the overdose epidemic, it was spurred on by a shift in the drug market from primarily being a heroin-based market to suddenly the drug market shifted and only cocaine was available and people started injecting much more frequently, and the city services were just not in a position to keep up with that. So after implementing Insight as part of a combination of measures, and I think that's really important, right? Like overdose prevention sites alone are not some panacea. They need to be part of a thoughtful and comprehensive approach to mitigating drug-related harms. So Insight was implemented alongside expanded access to opioid substitution treatment, a decentralized and expanded sterile syringe distribution service, HIV antiretroviral treatment. The HIV epidemic was rapidly brought under control. And in fact, the year prior to the site opening marked the high water mark for HIV infections among the city's people who inject drugs. And the ensuing years have just seen a steady decline in new infections to the point that the epidemic has effectively been successfully controlled. And that is a major accomplishment. And it is in no small part because of this opening of the overdose prevention sites as part of this comprehensive approach that we were able to get that HIV epidemic under control. At the time of the opening of this overdose prevention site, though, it encountered substantial opposition. The federal government of the day, the local Vancouver Police Department, neighborhood business groups, Vancouver's Chamber of Commerce, and many local politicians and community members were loudly opposed. Soon after it opened, though, and its impact on its clients and neighborhood became evident, the landscape totally shifted. And a report commissioned by the federal government on the site's impact noted the following, and I'm quoting here: letters of support and surveys show that health professionals, local police, the local community, and the general public have positive or neutral views of Insight services, and the majority wish to see the service continue. So I think it's important to note here that there are many misconceptions around what overdose prevention sites are, but once they are put into place, their benefits to both the clients that use them and the broader communities become rapidly evident. The fact is that the site did the things it was supposed to do. And don't take my word for it. There are, I think now, certainly over 50 peer-reviewed scientific studies that have been published in the world's leading medical and scientific journals, including The Lancet, the British Medical Journal, the New England Journal of Medicine, and many others, showing that Insight and other supervised injection facilities and overdose prevention sites reduce public drug use and drug-related litter in the area around the site, reduced HIV risk among its clients, connected a substantial proportion of its clients to substance use treatment, and saved the life of every single person who overdosed on site. And so now there are overdose prevention sites in many, many different countries. As Helen Clark mentioned, there have been millions of injections undertaken on site in these overdose prevention sites, and there has not been a single overdose mortality event in any overdose prevention site ever. That's an incredible track record. It's also notable for what did not happen after Insight opened. It didn't lead to an increase in crime, it didn't lead to an increase in violence, and it didn't lead to an increase in drug use. Now, the Center on Drug Policy Evaluation, the research group that I lead in Toronto, has been conducting a scientific evaluation of Toronto's overdose prevention sites since 2018. There are 9 of these sites in total across Toronto, all of which were implemented in the midst of this overdose crisis that we are still contending with. And the sites employ, and I think this is important to understand as well, is that they all employ different models. So there are, but at minimum, all of them provide access to a private, medically supervised space for people to use drugs. All distribute naloxone widely and freely. And they also distribute sterile syringes and provide harm reduction and safer drug use education. And they all also include, at minimum, referrals to other social and health services. One site, The Works, which is directly run by Toronto's public health agency, is located in the downtown core and provides both a space for people to use drugs on site, along with an addictions clinic where clients can be connected with methadone and other treatment options for their substance use. Another site, which is known as the Moss Park Overdose Prevention Site, is a low-threshold, largely peer-run service that includes referrals to emerging prescription models for addiction treatment, including heroin-assisted treatment, and safer supply models, which are basically low barrier access to addiction medications. And it also has a flexible model that accommodates and takes into account community need quite rapidly. So our group has been evaluating the services, as I mentioned. We've also established a citywide drug checking service that is a permanent fixture in the site or across the city. And we collaborate in partnership with all of these 9 sites to allow clients of these services to voluntarily provide a sample of the drugs that they're going to use. We then have those drugs analyzed at mass spectrometry laboratories at local hospital clinics, and then provide that information back to the clients, as well as have those data feed into a monitoring and surveillance system that can provide citywide information about what kind of drugs are emerging in our drug market. So our ongoing scientific evaluation has really reconfirmed a lot of the positive findings from Vancouver and elsewhere, but it's also demonstrated that overdose prevention sites are adaptable to different types of municipalities. So Vancouver is a very specific test case. Toronto is a large, dense city that is the 4th largest in North America, and public drug use is a lot more diffuse across the city's core compared to a lot of other places. So I think that's important to note as well, that these are adaptable interventions that can be put in place in a range of settings. I also want to mention just briefly, before I get into some of the results that we've found in Toronto, Helen Clark mentioned the experience of Switzerland. Switzerland was the first to scale up overdose prevention sites. What's remarkable in Switzerland is that in the years after the implementation of overdose prevention sites, again, as part of a comprehensive approach that included better access to treatment and social and health services, the incidence of people initiating injection drug use actually declined. And it declined quite dramatically. And this was on top of the incredible benefits that the Swiss saw in terms of a reduction in public drug use and public injecting. And that decline has, it was rapid at first, and it has continued. There was a decline in the number of HIV incident events. There was a decline in the number of people who initiated heroin injection, decline in public injecting, and this has been sustained over 20 years. So, these are sustainable approaches if done right. So in the case of Toronto, what have we found? Well, one thing that we were really interested in interrogating was this concern around the moral hazard of implementing overdose prevention sites. This notion of sort of risk compensation, where people think that something is now safer, so they take more risks. Well, we looked at this and we found that compared to people who visited these sites and were clients of these sites, there was no difference between people who did and did not in terms of their risk of overdose. So it's not like people who visit sites, overdose prevention sites, are going to take more risks simply because those services are there. I think that's a really important finding, and that is also in line with what we found in terms of other sites and other evidence that these people are not going to simply continue their use because they have access to the site. In fact, people who access these sites, both in Vancouver and we found also in Toronto, that they are more likely to be referred to services and more likely to actually uptake those services, including treatment and primary care and referrals to housing and other necessary services. So in the case of Toronto, more than a third of clients of overdose prevention sites were referred to other services. And as I mentioned, because we have so many different models in Toronto, some of the sites actually provide those ancillary services on site, and those that did saw both higher referral and higher uptake of services. Though I just want to note this, that all of the sites, regardless of model, were effective in promoting service referral. Now, the last thing that I'll mention here, and I think it's really important, is that we observed positive impacts of these sites on overdose mortality reduction beyond the walls of the sites themselves. So we've partnered with the Ontario Provincial Coroner's Office to look at the patterns, the spatial patterns of overdose mortality across Toronto year over year. And what we found is that after the sites were implemented, the areas near the sites, basically in 1 kilometer area of the sites, experienced a dramatic decrease in overdose mortality compared to other parts of the city. Not only that, year over year, the reduction in overdose mortality in the neighborhoods surrounding these sites increased. So the positive impact of these sites actually improves the longer that you have them in place. And so I think, this is for us a really, really important finding, and just I think really emphasizes that these are not just standalone services. These are services that work in tandem with a comprehensive approach, but can also have an impact far beyond their walls, and can have a positive impact across broader communities. So are overdose prevention sites a panacea? No, but the evidence spanning decades from across Canada, Western Europe, and even now the United States, and it's quite bizarre seeing the United States start to implement supervised injection facilities and overdose prevention sites, but that's the reality that we're in. The evidence is clear. Overdose prevention sites are an evidence-based and comprehensive, and part of a comprehensive approach to responding to the needs of people who use drugs and the communities in which they live. They can save lives and help reduce social tensions arising from public drug use, and they can help prevent the worst of the inevitable public health crises that always emerge related to substance use. What's critical to averting these, though, is implementing a site with clear understanding of community need. If you establish a site that does not have sufficient space or appropriate services for the population you're seeking to serve, then you may run into issues. So I think it's just really important to have a clear dialogue and build services in partnership with their intended clientele to make sure that your design is as effective as possible. And this is the best formula to make these sites as boring as possible, which is what we all want to see ultimately. So Canada is a leader in developing novel and effective responses to substance use, but we have been forced to do so in the midst of intersecting epidemics of HIV and overdose. So the response, for all of its good, in Canada has been hampered by delays and a lack of political will to scale up services before crisis hits. I implore you all to learn from our successes and our failures in equal measure. New Zealand has an opportunity to emerge as a world leader on evidence-based and effective responses to substance use, and to avert the catastrophes that other countries have experienced. If you seize that opportunity, you will be rewarded in lives saved. Thank you.
Kia ora tātou. I'm going to say thank you to the live stream audience who are disappearing now. And just to acknowledge our local electorate MP, Chloe Swarbrick, who's here in the room. We've got media waiting to ask questions. But just before that, I just want to offer you an opportunity to